sponsors.
Sagoli, I'm Milton Dallas from the Oneida Nation of Wisconsin. I entered the drug destruction business in 2010 because I've seen firsthand what addiction can do to families and communities. The world has literally changed because of the opioid crisis. We were all raised to learn and give back to our communities. I am truly blessed to present these proven drug disposal solutions to my people and our nations. Our X-Destroyer drug disposal products and harm reduction kits are my way to fight back. Simply add your old and unused medications to the container, reuse till full, and when full, discard with the common trash. Let's one-up the feds and make Drug Take Back Day every day in our Native communities. Ask your tribal leaders to visit rxdestroyer.com to order samples and receive education and sustainable implementation plans today. The 7 generations has never needed your leadership more.
Nat-Sioux Behavioral Health, owned by the Skull Valley Band of Goshute Tribe, offers culturally grounded care for substance use treatment. We blend native traditions with modern treatment for whole person healing. Amneal makes healthy possible by supporting recovery through access. As a leading U.S. affordable medicines company, Amneal is committed to delivering medications for the reversal and treatment of opioid overdose and dependence, including naloxone nasal spray and buprenorphine naloxone sublingual tablets. Visit amneal.com to learn more. The Cherokee Nation is committed to protecting our inherent sovereignty, preserving and promoting Cherokee culture, language, and values, and improving the quality of life for the next 7 generations of Cherokee Nation citizens. Heart Drum is an acclaimed imprint featuring stories for children and teens by Indigenous authors and illustrators. Heartfelt, groundbreaking, and unexpected, these beloved books emphasize the present and future of Native peoples and the strength of young Indigenous heroes. This live stream would not be possible without each of you.
The opioid crisis is a public health emergency characterized by the widespread misuse of prescription and synthetic opioids, stemming from the overprescription of highly addictive prescription opioids starting in the 1990s. The overdose epidemic is a public health crisis driven by the presence of the highly lethal synthetic opioid called fentanyl in the drug supply, including cocaine, ecstasy, and methamphetamine. This means people can overdose on fentanyl without knowing the drugs they are ingesting are mixed with it. Overdose occurs when a toxic amount of a drug, or a combination of drugs, overwhelms the body. Opioids bond to the same receptors in our brains that affect our drive to breathe. When an opioid overdose occurs, the drive to breathe is compromised. With opioid overdoses, surviving or dying wholly depends on breathing and oxygen. Fentanyl is a synthetic opioid 50 times stronger than heroin and 100 times stronger than morphine. It is often found in non-opioid drugs, driving overdoses among the non-opioid addicted population. It was present in 66% of overdoses in 2021, according to the CDC. Tranq is a street name for xylazine, a sedative approved by the U.S. Food and Drug Administration for veterinary use only. Tranq is not an opioid, but it is often mixed with fentanyl. Injecting Tranq causes severe open wounds, referred to as Tranq wounds. Carfentanil is a synthetic opioid, approximately 10,000 times more potent than morphine and 100 times more potent than fentanyl. It is used to tranquilize large animals such as elephants and rhinos. Naloxone is a life-saving overdose reversal drug that works by blocking opioid receptors in the brain. Naloxone is a nasal spray that can be administered by anyone. It is often referred to by the brand name Narcan. Fentanyl testing strips are used to detect the presence of fentanyl in other drugs. Harm reduction is the evidence-based public health strategy used to reduce the negative effects of drug use. Medication-assisted treatment, or MAT, is the use of medications such as methadone, Suboxone, to facilitate safe opioid withdrawals by relieving symptoms and controlling cravings. Combined with behavioral therapy, MAT is highly successful.
Welcome to our Reducing Drug Overdose Deaths in Indian Country live stream. I'm Levi Rickert, editor and publisher of Native News Online, proud citizen of the Prairie Band Potawatomi Nation. So welcome. This is I want to say the fourth live stream we've done on opioids. And as I've told you before, we don't think 1 hour long live stream dealing with the subject that is an epidemic in Indian country will solve any problem. But what we're trying to do today, our hopes would be is that you can take away something that could help alleviate what's going on in Indian country. Here at Native News Online, we've done extensive reporting on this topic because we know what a big challenge it is in Indian country. Today, joining me in the first part of this live stream is my friend, the Cherokee Nation Principal Chief, Chuck Hoskin. There he is. Welcome, Principal Chief Hoskin. How are you today?
Levi, I'm doing well. Thank you for having me. I appreciate you covering once again this really important subject.
And I want to thank you and our other sponsors for sponsoring this important live stream. We just feel like messaging is just so critical. And, beyond messaging, getting to the truth of the matter is what's really important in these days where there's so much misinformation out there and loss of federal funding right and left in Indian country. That's one of the things I want to talk to you about, Chief, is how's the Cherokee Nation dealing with? And we see the proposed budget that still needs to work its way through Congress. And just yesterday, they had a hearing on Capitol Hill of the Senate Committee on Indian Affairs about the vast budget cuts proposed for Indian country when it comes to healthcare. And in there is funding for substance abuse. So tell me, how's the Cherokee Nation dealing with that? And then beyond that, how can tribal nation leaders throughout the United States, throughout Indian country, combat this?
Well, we have reason to be concerned. I mean, if you look at the budget proposal, the so-called skinny budget from the President of the United States, there are cuts, and this is, of course, what we read in the news, but you also see it in communications from agencies about what the budget is. And the budget for HHS has dramatic cuts. Now, that's the really discouraging news. Now, the encouraging news is what you mentioned, which is we know this is a process. We know that the Congress always takes a skeptical look at a presidential budget, and that's really irrespective of which party is in control, although this particular budget has some really steep cuts in health programs. And that's the thing about addressing the opioid crisis. It is really an all-of-government approach. We think about the funding streams that provide dollars for recovery programs and things of that nature. But the truth is, there's a healing that needs to be done on the individual level and the community level. That often involves a lot of other things across health programs, even extending into other things that impact people's lives, such as housing. So we're looking at those with some concern. We're encouraged that the Congress still has to take a look at it. I've been encouraged by meetings that I've had, not private one-on-one meetings, but meetings at tribal advisory committees with the HHS Secretary Kennedy and with Dr. Oz, who's head of the Center for Medicaid and Medicare Services, with the Department of Interior Secretary Doug Burgum. The encouraging takeaway from those meetings is that there does seem to be some sensitivity expressed with respect to the unique needs of Indian country and the unique obligations from the United States. None of that means we're getting funding boost. It just means we might have somewhat of a safe harbor on some of these funds. But if we lose funds, we're going to lose ground. We know that because I know what we've done, Levi, in the past 5 years, which is we've increased our capacity for behavioral health programs. That means more patients getting in. People that are struggling are more likely to get in today to a counselor than they were a year ago, 5 years ago. We are also addressing problems with our own dollars. And that's something that if a tribe can do, well, we got to do. So we're building a drug treatment center, and we're not spending a penny of federal dollars on it because we've made the opioid industry pay for every single penny of it. We sued them, bent them to a settlement, created a $100 million fund, some of which is going to build brick and mortar. And we've got to have a new drug treatment center in the Cherokee Nation, and we're doing it. We seeded a harm reduction program, Levi, with some of those dollars But then we got a grant from SAMHSA to scale it up. That program is saving lives. I mean, harm reduction programs, whether you want to call them needle exchange programs, whatever you want to call them. Ours is as comprehensive, I think, as you can get. We've had 5,850 people encounter that harm reduction program. We've got people on a path to, at least they're oriented towards a safer, healthier life and hopefully recovery. If that SAMHSA grant were to go away, we'd have to backfill it somehow. I think we can absorb it, but should we have to absorb it? Because here's the other thing, Levi. It's not an accident that we are overwhelmed with this drug addiction problem in Cherokee Nation or across Indian country. It's not just because it's built into our DNA, right? We suffer from the same issues that the rest of the country suffers from, but we also have generational trauma. We also have generations of federal Indian policy that caused a great deal of this, and the feds caused it with their policy. They ought to fix it with their policy. So we can't let them off the hook when it comes to federal funding.
Well, I appreciate that answer because you're 100% right. We are living examples, results of so many decades, if you could even argue centuries of neglect and abuse among our people. And I really appreciate what you are doing at Cherokee Nation, because you've been on, I think this is your fourth one of these you've been on. And I also appreciate you coming on because you bring that perspective and you bring the vigor that really, is required among Native people. Tribal leaders have to have their hands on the wheel when it comes to these types of crises that we're dealing with. And so thank you very much, Chief. And what I'd like to do, and I know we have a very short time with you today, but bring you back and do a Native Badashwe when we can really, as the budget process unfolds, you can bring more light, because I really appreciate what you said. And I know you serve on those tribal advisory committees, councils with the secretarial level, and which is so important. And you being a leader of the largest tribe in America, I appreciate all that you do. Chief McGee to you.
Levi, thank you. I know you've got a great panel, because before we started just chatting with some of those panelists, you were there. We were going back and forth on what tribes are doing. There's a lot to be learned by learning from each other across Indian country. We can solve this problem. Thank you.
Thank you, sir. We'll bring you back to Native Badashwe soon. Have a good day. And we are going to move right into a panel. We have a lot to cover today, and always limited time, it seems like. And I will just plug that we will do part 2 in October 17th of this live stream. And as I said earlier, you can't solve the epidemic in one live stream. So we have committed to doing 2 this year. And we also have a weekly stream called Native Badashwe that comes on every Friday at 12 noon Eastern time. And we do periodically cover this very subject. So we are at Native News Online very conscious of what's going on, and we really want to do the best we can for Indian country. Now with our panel, I do want to make some introductions. Raquel Ramos. She's Comanche. She's the Prevention Program Manager at the National Indian Education Association, co-founder of CADCA, Indigenous Peoples Advisory Council. We'll let her talk about that a little more. And then we have Clayton Clark, who is Choctaw Nation of Oklahoma, peer recovery support specialist. And we also have Steve Knockwood, and he's Micmac, I believe, and he's from First Nation and Arlstadt Nation, cultural healing advocate for the Wabanaki Public Health and Wellness. And then the last panelist on this first panel is Samantha McGee. She's a grant project director at Choctaw Nation Health Services Authority. Welcome all you panelists. How are you today?
Good.
I'm doing good.
And thank you for the fine work you're doing in this very difficult topic. We want to paint a picture of the issue before we talk about solutions. For those in leadership in tribal healthcare, please talk about when your community started seeing the signs of the opioid crisis. Who wants to answer on first? Raquel?
I can, yes.
Okay.
So It was around 2013 in Southwest Oklahoma was the first time I became fully aware that we were in the middle of a growing opioid crisis. We began to see it clearly through our local data that revealed a disturbing trend that our Native girls were misusing prescription opioids at a higher rate than our boys were. And so that, of course, raised a serious red flag. As a prevention specialist, I realized early on that these weren't isolated incidents. Our young people were quietly suffering, and opioids were becoming a coping mechanism for deeper issues. At the time, our community wasn't even fully prepared. We lacked prevention infrastructure, and the conversation around prescription drug misuse was still very hush hush. But the data gave us something to act on, and it confirmed what many of our elders and school leaders were seeing was that we were losing many to the silence of the stigma of opioids.
Clayton, do you want to address that same question?
The way she is talking about how it's being used just to be able to address certain other issues like mental health issues, that was one of my big issues. Was I was self-medicating in order to deal with my mental health diagnosis and to be able to deal with life in general.
And how long have you been in recovery now?
It'll be 6 years this July 23rd.
Well, congratulations. Keep on that path, brother. That's what we want to hear, success stories. Steve, tell me about what's happening up in Maine. How'd you become aware of this problem up there?
I'm somebody who has lived life experience as somebody who used substances. With me, I was actually born addicted. And then opioid pain medications became a regular part of my life by the time I was 17, 18 years old. So, yeah, it's prevalent up here, and I think a part of everybody's life.
Mm-hmm. Samantha, tell us about your community.
The Choctaw Nation, they look at the data, and they actually started their own tribal naloxone program in 2015, back before it became, as commonly used as it is now. And then 2016, they applied for a SAMHSA grant, the FR Care grant, which we got awarded, and it started in October of 2016. And the FR Care grant, it is focused on first responders. And so they basically, we train first responders in the 10.5 counties, and that was kind of the first step towards, reducing those numbers, just because the majority of Choctaw Nation is very rural, or, most of it, more, I guess it is a majority, but it's very rural. And a lot of these places are an hour from the nearest emergency room. And then even with ambulances trying to get to somebody, it could be 45 minutes or even longer if they're already tied up somewhere. So it was huge that they started their own tribal naloxone program in 2015 because, they were already noticing that there was a problem. And then being able to get awarded that funding from SAMHSA, that was amazing. And so now that's actually one of the ones that they've listed to propose that they want to cut from the funding is that FR Care grant. And honestly, it's just been such a huge, it's made an impact. It's made such a huge impact as far as reducing the numbers in the Choctaw Nation jurisdiction. And so losing that funding would be honestly detrimental, I think, because now a lot of our first responders, we actually got another round of funding. So, we're going on over 7 years of having this FR Care funding. So our first responders, they're used to being able to have naloxone access at their fingertips. And if that gets taken away, then I do fear that will change, because some of these rural communities, they're not going to be able to find room in their budget to pay for stuff like that. And so.
Tell us, where is the Choctaw Nation located in Oklahoma? For those who are.
We have 10.5 counties in southeastern Oklahoma, and then right above us is the Cherokee Nation, and they have 14 counties. I don't know if you've ever heard of Interstate 40, I-40. It runs from the East Coast to the West Coast. That's pretty much what, not like exactly, but that highway is kind of what separates the Choctaw Nation from the Cherokee Nation. So Choctaw is southeastern, and Cherokee Nation is northeastern.
Mm-hmm. And Steve, talk about your community in Maine. Is it rural, urban, your tribal community?
Here in Maine, we have 5 different indigenous communities. Penobscot Nation, which is relatively urban. The other 4, which are the Micmac, the Maliseet, and 2 Passamaquoddy communities, those are very rural in northern Maine, right on the Canadian border.
And I guess I'd like to get a flavor for, so often people think of drugs as being a problem with recreational drugs, but do you have any of your community members who may have, because of being overly prescribed, have become addicted? Can we speak to that? And I'm assuming male, female, covers various generations. And Raquel, can you speak to that?
Sure. I live in Southwest Oklahoma, which is Lawton, which is a military town in a sense. And just being overprescribed opioids or pain medication whenever our young people actually get into an accident or if they have an injury from playing sports, because in our area we have a lot of athletes because that's pretty much all there is to do. And so just them being overprescribed, and even our elders, at one point it seemed like, my mother, who has passed on already, it seemed like, she was constantly going to the hospital and they were constantly sending her home with opioids. And I'm like, why are they doing that? And so just being able to go with her and explain to them that these are addicting drugs and, take as prescribed, which she did, but to me, they were overprescribing her. So just being able to go in and advocate for her health, and also to be able to go in and teach the youth in the school systems about opioids, or if they're injured, not to continue taking the medication just because it's there. And once it's gone, it's gone. So that's a little bit of what we've seen in our area. So thank you.
Yeah, and Clayton, why don't you address that? Then we'll move to the next question.
Seeing in the past how it was prescribed very often, the program that they have now to be able to track how much you're prescribed has helped out quite a bit. But still, with certain injuries and certain things that go on with people, they tend to try to give them something a little bit more powerful. People say, "Oh, I'm hurting a little bit more," and they give them just stronger medicines, so that actually helps them fall into addiction faster. So I just kind of wish that something like that would be kind of tracked a little bit more also.
Yeah, we'll get into solutions later, but let me go to the next question. We know that there are many factors that result in Native communities bearing the brunt of this crisis, such as generational trauma, lack of funding for healthcare and law enforcement, and the systemic inequities. Can you please talk about how these factors manifest in your communities and exacerbate the opioid crisis? Let's go with Samantha.
Yes. So as you were saying, in Native American populations and communities, they're already, like a disparate population. And so, like you said, it's a generational thing. And again, the rural nature of these communities, I think, plays a huge part. It's almost like you're already being set up to fail, kind of, just because you do not have access to things. And so, to be honest, it's hard to see it when you're in like the thick of it and you're doing the work and you wonder if you're making a difference. But like the prevention aspect, they do make a difference. And it's one of those things where you may not notice it right now. It's something that we will see, and we will feel the effects of the work we're doing right now. We'll feel it in the next generation. But yeah, I mean, it's just kind of like when you're born, and like we all still live here, and our ancestors are from here and our families are from here. And it's just a generational thing, and like lack of resources in the rural communities that are Native American communities. So.
Yeah. And Steve, what about you in terms of your communities, the loss of funding? How's it impacting? your programs?
From what we're seeing up here in Maine, and I mean already our own organization, which we serve all indigenous communities within Wabanaki country, we've had to really take a look at how we're utilizing, every dollar and making those dollars go as far as they can. Talking about, those differences within our communities, and our communities, the two major sources of income for individuals is our offshore fishing industry and also our logging industry, both of which are among, the most dangerous jobs that you can have. So, we have a lot of pain in those communities.
Yeah, Raquel, can you talk about your community?
Sure. So in the communities like mine, whenever we're talking about opioids, that crisis didn't just appear out of nowhere. It's rooted in generational trauma and systems that have failed us for decades. When families carry unhealed trauma from boarding schools, land loss, and broken promises, broken treaties, it creates layers of pain that can lead to substance use as a form of escape. And even on top of that, our tribal health programs are often underfunded and they're overburdened. We have limited access to culturally appropriate behavioral health care and treatment options. Our law enforcement is stretched thin, and sometimes they don't even have the resources of trauma-informed training to intervene early. And then, of course, all of this creates the perfect storm where prevention becomes reactive instead of proactive, and our youth are left without the culturally grounded support systems they need to thrive. So, these aren't just risk factors that I'm talking about. This is reality, and it's everyday life that a lot of our tribal members and communities live in.
Thank you. And Clayton, you have the last word on this one.
Well, around where I live, there's two big jobs around here. We have the tire plant and the refinery, but other than that, it's very hard to find, and one of them's getting taken away. So people are getting depressed and starting to turn to something to make them feel better. The law enforcement is always working to try to help them and get them to behavioral wellness crisis center. And then the generational trauma, just 2 generations ago, my grandma's generation was in the boarding schools. So that kind of spilled over in my dad's generation, which alcoholism, drugs still was really prevalent. And then my generation, which thankfully I was able to make it out, start recovery and keep prolonged recovery, but not a lot of my other cousins and siblings were able to do that. So it's a big problem.
It is a big problem. And thank you. And we're going to thank our sponsors one more time.
Miigwech to our sponsors. Natsu Behavioral Health, owned by the Skull Valley Band of Goshute Tribe, offers culturally grounded care for substance use treatment. We blend native traditions with modern treatment for whole person healing. Amneal makes healthy possible by supporting recovery through access. As a leading U.S. affordable medicines company, Amneal is committed to delivering medications for the reversal and treatment of opioid overdose and dependence, including naloxone nasal spray and buprenorphine naloxone sublingual tablets. Visit amneal.com to learn more. The Cherokee Nation is committed to protecting our inherent sovereignty, preserving and promoting Cherokee culture, language, and values, and improving the quality of life for the next 7 generations of Cherokee Nation citizens. Heart Drum is an acclaimed imprint featuring stories for children and teens by Indigenous authors and illustrators. Heartfelt, groundbreaking, and unexpected, these beloved books emphasize the present and future of Native peoples and the strength of young Indigenous heroes.
In Indian country, we know the dangers of the opioid crisis all too well. Many of our communities are by definition facing extinction-level losses. But there's something you can do right in the privacy of your own home. RX Destroyer's products make destruction of unused medications simple and safe before they become a danger to your loved ones. No burning, no flushing, just an eco-friendly and scientifically proven way to destroy drugs in the convenience of your home. Protect your community, protect your family and home, protects your next 7 generations. RX Destroyer is how we break the abuse and misuse cycle, one household at a time.
This live stream would not be possible without each of you.
Hello, my name is Elise Wild, and I am the Senior Health Equity Editor at Native News Online. I covered the overdose crisis in Indian Country through a solutions-focused lens. Along with Native News Online, my work has appeared in The Guardian, National Geographic, Elle Magazine, and on NPR's Seattle affiliate. I was honored last year with the 2024 Excellence in Recovery Journalism Award from Faces and Voices of Recovery. As well, last year, I was really fortunate to get support from the Pulitzer Center for Crisis Reporting for a 3-part series called Two Medicines that explored how tribes and Native-led programs are blending traditional cultural practices with addiction medicine to help their relatives heal from the opioid crisis, from prevention to harm reduction into recovery. And many of our panelists today were featured in those articles, and I'm very happy that we can all continue this good work together. Joining us for this panel is Milton Dallas Jr. from Oneida, the founder of RX Destroyer, Raquel Ramos Comanche, Prevention Specialist, Whole Child Initiative at NIEA, co-founder CADCA, Indigenous Peoples Advisory Council, Lisa Saka Basin Passamaquoddy, who is the co-CEO of Wabanaki Public Health and Wellness, Arlene Brown from Bishop Paiute, who is the founder and CEO of Crossroads Recovery Center and Skoden Native Harm Reduction Services, and Samantha McGee from the Cherokee Nation, who is the Grants Project Director at Choctaw Nation Health Services Authority. Thank you guys all for joining us for this. So we are going to go through those 3 stages of healing: prevention, harm reduction, and recovery. So to start off, we know that opioids do not discriminate against anyone. Addiction affects elders, parents, youth. They affect whole communities. So I'd love to hear from our panelists about the measures you guys have taken to raise awareness around opioid and fentanyl addiction, target messages to those particular populations, from youth to elders to families. And who would like to start? Well, I see you nodding your head. Should we start with you?
Sure, I will start. So, in the communities that I've worked with across the nation and in Southwest Oklahoma, we take a whole community approach rooted in cultural prevention. Our tribe has taken a practical step by installing medication lock cabinets in tribal homes. And this was the Wichita affiliated tribes. And it included the houses that were rented, rent to own, or owned, that were under the jurisdiction of their housing authority. But prior to doing this, a tribal resolution was established, which is considered a law in all tribes. There are billboards in town, as well as the interstate bringing awareness of opioids and fentanyl. But the uniqueness of the billboards that I see today, as opposed to 5 years ago, they're tailored around our Native communities. You'll see somebody there that who's a princess or a war dancer or an elder, and we didn't have that years ago. And so whenever a Native individual, they're drawn to something that's Native, and so they're more likely to actually read that.
Thank you. Arlene, let's go with you.
So we think it's really important to be able to hit everything with everything you got and at every angle. And some of our messaging, just to try to destigmatize medication for addiction treatment, for naloxone distribution, is really changing the narrative to remembering that this isn't just for people who use drugs. It's for our elders. It's for the grandma who forgot the medication got changed. It's for a youth that finds it. It's for youth that are just experimenting. They don't know what they're getting. And so we really try to just change that messaging so that we're looking at that we're protecting all of our youth, our elders, and really, because people, if they're embarrassed to get it, they won't get it. Easy access, so like no barrier, just being able to get it out, get it into as many homes as possible. Doing other creative things like creating tribal substance use navigators, detox navigators who can really speak to getting into the homes to be able to create safety plans, and just raising general awareness, and shifting to the medical model of addiction rather than blaming and shaming families is a really huge piece of it. We do that with the tribal language, just sharing that message, culturally, and really decolonizing all of the services from harm reduction to behavioral health services to the messaging. That's the hugest piece, is that take that, make it ours, and really decolonize it so it makes sense for our tribal communities as well. Another huge thing is working with our local healthcare systems, because we don't want people afraid to go in. 28% of people that go into the ED, that's how many people are coming in who are actually getting screened. And they screen for SUD, and you can get addiction treatment in the emergency department. And I think that's really huge. And more clinics can be adapting that kind of model of care, so they're getting the resources that they need. And I think there's other important messaging that people need to understand too. When someone overdoses, their chance of dying within the next 48 hours is huge. And even within that next year. And so I don't think that messaging comes across too much to others.
Thank you. Lisa, tell us what you guys have going on as far as messaging and prevention at Wabanaki Public Health and Wellness.
Yeah, thanks, Elise. I would say we started our organization, in the public health space. So Wabanaki Public Health and Wellness is a fairly new organization with a deep history. And we started in the public health space. So connecting to messaging was always important. And how we really focused our messaging around substance use disorder was around a disconnection. We also thought, as Arlene talked about shame and stigma and not holding on to that. We heard from Chief Hoskins and also Levi about our history and why we have these deep wounds. And so that disconnection from culture is understandable. And what we try to do in all of our work is more of a connection to culture. So I think about one of our programs is around commercial tobacco addiction and our connection to our traditional ways and our connection to the traditional practices of tobacco is a way that we center our messaging always, and also really try to provide that reconnection opportunity. We do this on at one of our properties. We know that connection to land is so important. That's where we learn a lot of lessons, and we also receive a lot of healing. And so at the Gathering Place, which is a multi-acre place along the sacred Penobscot River in Maine, we do a lot of projects. We build a greenhouse because we have a food sovereignty program. And what we do there, I think about Raquel's whole community approach. And that's what we believe too. So we bring together people who work and are served in our substance use area programs together with young people. And we build that greenhouse together. We have a shared mission and purpose of providing our Indigenous foods to our communities. And while we're doing that service project, we're also talking about our stories, talking about the difficult journeys that we have traveled, and we learn from each other and from other stories. So a lot of our messaging and a lot of the work that we do is all about centering culture, knowing that culture is prevention, and also knowing that that's what's going to bring us back to healing. So much of our messages, as I said, are really those cultural messages that were, people attempted to take away from us. And now we're putting them front and center and making sure that those messages are loud.
I love it. Culture is prevention. Milton, let's hear from you.
Nationwide, we see that how we approach it is really behavior changes through education, right? So we know that a lot of folks have unused medications stored in their medicine cabinet. And just historically as human beings, right, we've held on to all these things. Well, there's, bad actors out there that are taking advantage of this good nature that we've all learned from, and, to really stockpile our drugs or medications or whatever we have. So it's a behavior that we need to change, kind of like seatbelts, right? It took quite a while for us to start clicking seatbelts, but now we really need to start getting rid of those unused medications in our cabinets. So we spread the message, and we train, and we provide a lot of materials for just about everyone, every community, every type of business, to say, hey, this is how you can move forward with getting rid of drugs, not only in your community, but started in your home.
I love that. That's so true. The seatbelt analogy is so good. I think my mom probably still has antibiotics that
Everyone
I took
does.
as a kid.
Everyone does.
Yeah. Samantha, let's hear from you.
And one thing about the Choctaw Nation is they are so huge on taking a community approach in pretty much a lot of things that they do. And that is no different when it comes to substance misuse and abuse. We're really huge on just partnering with other, community stakeholders. There's no need to reinvent the wheel. The way that we view it is like we're all on the same team here. And even though the Choctaw Nation is 10.5 counties, they do understand that there's a lot of non-native people who live in our communities. And so it's not like they're not, just like, oh, we're only going to serve a tribal citizen. I mean, they'll do naloxone drives where anybody in the community can come through and get a free, Narcan kit. I know, like, even community first responders, if there's something that they feel like they're lacking, they'll reach out to the Choctaw Nation, and if they're able to assist with that, they will. And so I think just it's amazing to see how everyone is just like a team player, and just community in general. It's just so nice that everyone's like, on the same page and just like helping each other. So.
Awesome. And we will, for those of you watching, if you guys have any questions, please put them in the chat. We will have time at the end to answer questions from the audience. And now we are going to move on to harm reduction. And we know that harm reduction saves lives, but it also is something that scares a lot of people. There's a lot of stigma against harm reduction, and we know that a lot of communities are very resistant to the presence of it in their communities, whether that be providing Narcan, needle exchanges, or fentanyl testing strips. So I'd like to hear from you guys how you have helped your communities acclimate to the idea of harm reduction, and also your tribal leadership as well, to get those programs launched. And Arlene, I'd love to hear from you first. I know you and I have had several conversations about this.
Absolutely. Thank you. Harm reduction is crucial and essential because it works with the people who are actually the ones using the drugs, right? If we think about our natives who need the most help, this brings the services right to them, and it breaks down any walls or barriers. This is crucial because a lot of them are not coming in for, into offices, making appointments and whatnot, but this starts building that trust, and this starts really engaging. And we were the first syringe exchange program certified in the state of California for Indigenous people. And I always tell this when I share this with other people is that the actual syringes is the least amount of my work, because we do so much in engaging and working with our tribal people that we're building relationships. We do a wellness journey that is based off contingency management, but and it's only for people who use substances. And so we go to them weekly. They get case management services. They're engaging. We're bringing them resources. They're being empowered by it. And harm reduction in our tribal communities is absolutely not new. So that's one of the key takeaway points. We've been taking care of our Native people since the beginning of time, right? And so it's not new. It's crucial. And these are proven ways to save lives, right? And so we just bring them in, love on them, keep them in that sacred circle with us. And that's really how we kind of reframe harm reduction and build off of that. And so when we're engaging with them and we're increasing healthier choices, we're empowering them to feel better about their lives. We're giving them opportunities, and we can get someone right from their front doorstep right into rehab, because we can go scan their paperwork. We can help them make appointments. We can do all of that. But that's through the harm reduction program that we're able to do that. And so we're able to love on them, and they start loving themselves a little bit more every day, right? And there's no stigma, there's no shame. We don't come out there saying, hey, you need to quit this, you need to quit that. But then we're talking about safety plans with them. We're giving them options for detox. We are, going to the hospital with them. We're making safety plans with the family. We're getting them in touch with all that. And then we're doing it all through culture. So our wellness journey is actually done, through the medicine wheel model. They engage in it. Like I said, they're doing, they fill out their packets, their goals, And they do it all through that. And then it's beautiful to watch because they're the ones coming up with the goals. And then they're the ones doing the engagement. And some of it's just, we bring them closer to their culture. So we have things translated in our tribal language, and then they get to learn, a piece of that. That's a huge piece of some of the work that we do. We do, snack bags for them. We do safety kits. Everything is just done in that, in terms for them. And so they don't feel that pressure. And I think that's, been one of the most successful pieces, plus our stance on no barrier, right? Like, we want, access to services immediately. If you want to go to the emergency room to get treatment started because you have urine withdrawal, or you just know it's time, we'll go accompany you to the emergency department. And I think that's the hugest thing, is our threshold is really low for services and engagement. And doing it from the whole spectrum, right? We need to work with that population. We also need to do prevention. So those are like some of the multi-pronged approaches that we're able to come up with.
I love it. I really want to point out, Arlene, how you used the word love several times as you were talking about those harm reduction programs, that harm reduction is an act of love. Probably oftentimes when people need it the most, or may not be able to love themselves at those moments when they're in active addiction. And that's really, really important. Samantha, I'd love to hear from you on how you guys acclimated the Choctaw Nation community to the harm reduction services that you guys now offer.
Well, I think starting, initially with our first responders did help a lot. Getting the buy-in, I feel like the stigma around that, it is still prevalent, but, in the beginning, it was so much worse, and people looked at it as just like a way to enable, like the typical stuff. And now we don't really have to get that buy-in. People are they're open-minded. And I think that's just because they're feeling the effects of how it's too close to home. And so that's not a great thing, because that means the numbers are worse. But so that has been, I guess, helpful, is that stigma's gone down. And that is, like, again, a community approach to education, getting in school systems and educating the kids. I was actually just on I'm on an advisory board for another SAMHSA grant that the tribe has. And they were just talking about how one of the things that they did, they trained, like, I think 400 students in this last quarter, and they did a whole PowerPoint on, fentanyl awareness and just some myths about it, and let the students ask questions. And so, and obviously the typical, like, naloxone distribution, drive-through events, drug take back. But one thing that the Choctaw Nation had started, and I'm not sure how long ago it was, maybe like a year or two, they have that small, like, Suboxone clinic out of our hospital in Tallahena. And so they're starting to take Suboxone patients, which, is medication-assisted treatment. And then they also got that opioid settlement funding. And so I know that there's a committee for that, and they're actually looking at different, like, a lot of different possibilities, but, maybe building their own, like, opioid use disorder facility that does medication-assisted treatment, and seeing how they can, like, expand that to where it's actually something that's accessible to everyone within the 10.5 counties, even in the sense of, like, transportation and like housing, and then partnering with other community entities that maybe do that as well. And I don't know, it's just getting that buy-in. And I think now people are, like, understanding that it is important, and they need it. They need it in the community. It's not a bad thing. It's saving lives. So.
Thank you so much. We are getting up to our time, so we are going to move on to our next portion, where we're talking about recovery. And we've heard from so many tribal leaders, community members, advocates, that culture must be the center of recovery. I'd love to hear from all of you on examples of this in your own communities. And Lisa, let's start with you.
Absolutely. Thank you for that. I will say, Wabanaki Public Health and Wellness, we serve the Micmac, Maliseet, Penobscot, and Passamaquoddy tribal nations in what is now called Maine. And in the work that we do around, culture, I guess it's everything that we do. You can't go into one of our locations, you can't walk one of our grounds, you can't enter into one of our programs and not feel the Wabanaki culture centered. And that comes in lots of different ways. I talked about commercial tobacco and the harm that it has caused in our communities. That's just one harm and addiction. That connection to culture and ability to grow our own tobacco and be connected to our traditional ways of tobacco, knowing that what has happened to tobacco is colonization, which has resulted in cancer, when connection to culture is going to result in healing. So we do that in lots of different ways. I will say it was a decade ago or a decade and a half ago when the tribal nation chiefs came together and said, how are we going to heal these deep wounds? We need a place where we can send our people that centers culture in that healing. And we didn't have a place. We didn't have a place even 7 years ago. So it took some planning and some effort. But what we wanted to be sure, given our history as well as our cultural values, that we wanted to create a place of healing that left nobody behind. And what we say at Wabanaki Public Health and Wellness every single day is wherever you are in your journey, we have a place for you. And very rapidly, we went from half a dozen people to 250 plus, but we were able to create a system that went from prevention to now treatment, medication-assisted withdrawal, every step of the way being able to center culture, and even quite recently serving non-Indigenous people and centering culture there too, and them finding healing just like we do. And so that's been an interesting journey too.
I know I was lucky enough to spend some time with you and some time with Steve this fall up in where you guys work in Maine, and I can say that you definitely, every Wabanaki building, every place that you guys have touched really has a very loving, embracing feel to it. So I think you guys are really achieving what you set out to do. Raquel, I'd love to hear from you.
So, in the community that I live in and Southwest Oklahoma, we've, I know that, for instance, the Comanche Nation, they use culture as a recovery tool. I want to also point out another tribe that I've had the opportunity to work with, which is the Cheyenne and Arapaho tribes. Their tour program has just exploded with recovery. They have a gourd dance group that goes out all over the community, and I even want to talk about, just for a minute, I want to talk about how them and the Southern Plains Tribal Health Board, whenever it comes to recovery or it comes to harm reduction, you can actually anonymously reach out to them and they will mail your harm reduction kits directly to you. Personally, I'm in recovery, have been for the last 23 years, and I use my culture as not only prevention, but as a recovery tool. And I think that it's just really awesome how our Comanche Nation has wrapped their arms around our recovery community, as well as the Kiowa tribe of Oklahoma. They've done the same. And just being able to see this just up front and being able to experience how others are welcomed into the arena, or how others are welcomed into treatment, and how they're actually welcomed into each of their tribes with respect and with passion and with love and with compassion. It's just really eye-opening to see that, because we didn't see that 10 years ago. It was like shh, they're in recovery, don't tell anyone, and now it's just like recover out loud. That's what I hear the Cheyenne Arapaho say, and other tribes, recover out loud. And I just think that's really beautiful for our recovery community.
Recover out loud. I love that. Milton, let's hear from you.
So Oneida Nation in Wisconsin, they take a holistic approach. So we work with the behavioral health group, with the drug prevention teams, housing, the primary education, the police department. So they're all made aware. And then we work with the monthly publication of the Kaliwizux, and they basically broadcast that, hey, this new tool is available to you. So they really are really good communicators in that, hey, there are solutions out there, use them. But then we also normalize it. Like, every person has, and their grandma and grandpas, their mom and dads have access medications in their cabinet. One of the leading things, and this isn't just true for natives, but just every human being in the country, is people are sitting on these unused medications, and they don't know how to ask their doctors or their pharmacists, hey, what should I be taking? What might be commingling and give me other issues? And then, of course, you get prescribed something else. So to be able to educate and change those behaviors, right? So prevention, in our opinion, is what it's all about. So it's like, how do you get to the point of not even becoming addicted? So let's get rid of those medications by asking the questions. Ask the professionals, hey, doc, why am I taking this? Why are you adding more to it? And the pharmacist is really there to say, hey, maybe you shouldn't be taking this. Maybe you should be talking to your doctor, and let's get these off your list. So using your resources is really important. I think another really big one that is, and the money seems to be there with a lot of tribes. You can't use teledoc, right? Pull these docs up on the internet, or a pharmacist, and ask those questions. So it's really a progressive approach to attacking the problem. Again, normalizing that, hey, everyone has this problem. Just kind of like Raquel said, it's everywhere. We need to just stop the stigmatism and say, hey, this is a problem everyone has. Let's deal with it.
Absolutely. We have just a couple minutes. But we have a question for you in particular. Weeks ago, that the program that your guys' harm reduction runs on is potentially going to be cut. It was in a leaked budget proposal for HHS that they might eliminate this program. And can you talk just a little bit, maybe a minute long, about how you guys are dealing with that? What other funding sources are you looking for? And this, we're hoping that someone tuning in here might probably be in the same boat, and we all got to work together on this, and a rising tide lifts all canoes, right? So let's hear about what you guys are doing to plan for that potential cut.
I'm so glad you asked this question. So one thing about me, I'm a hustler. And so I brought this to tribal leadership. And so we did get that opioid settlement. And I don't know the exact amount, so I don't want to speak on behalf of the tribe, but I know it was a lot of money. And I know one thing that they are adamant about was they were like, we do not want to nickel and dime this, and at the end of it, not have anything to show for it. And so whenever I brought this to them, I'm like, hey, this is most likely going to end. This has been supplying our first responders in the 10.5 counties, tribal and non-tribal, 2.5 years. Like, what are we going to do? And so they're basically trying to figure out a way how they can continue to fund this through that opioid settlement. That's kind of the plan. So they have a whole committee, and that's the goal. They just want to make sure that it continues on. So they're just going to incorporate it into basically a permanent thing within the tribe instead of being grant funded. So that's the plan. If it does end up getting cut, they just going to basically bring it on board and try to fund it through that opioid settlement. So.
Fantastic. Thank you so much. And we are going to see if we have any questions from the audience here. I think we may have had one. Levi, do we have a question from an audience member? Okay, here we go. Oh, so this is from Dr. Pfeiffer, who is viewing, I believe, on YouTube. When will we have the uncomfortable conversation about issues like this, along with pervasive DV, DA, and SA on the res? So is everybody up to speed on what DV, DA, and SA stands for? All right. So who wants to take this question about how important these conversations are to have, and maybe give advice for someone who wants to have these conversations in their community but might be meeting some resistance to that?
I know for the Choctaw Nation, they actually recently just held a walk to end DV, DA, and SA, and I think everyone wore purple, and it was basically just a huge campaign to raise awareness about it. And it was tribal and non-tribal that was invited. And so I know that's one thing recently that we just did here within the Choctaw Nation. So.
One thing about having these uncomfortable conversations, I feel need to start having them whenever, with young kids. For instance, I take my 10-year-old and 6-year-old boys with me to every recovery meeting I go to when I have them. And they sit there and listen to how this substance is taken lives and changed lives forever. And afterwards, if they have any questions, even if it's about my past, I try to explain it to them in a way that they'll understand. So these uncomfortable conversations are very important to have, especially when with young children. That way they know.
Really, I think this just goes back to those bigger issues when I think about, getting the reasons why people are using drugs off the reservations, right? We have to really hit those head on. There's bigger systemic issues that keep us in our sickness if we're not going to start, having those conversations or start healing. And I know there's movements, and I know there's, raising awareness and education, but really coming together, in our tribal communities to say, hey, we're either going to protect the predator or we're going to protect the child. We can't do both, right? So we need to speak up and speak out against molestation, sexual abuse, and make sure that we're not allowing that in our tribal communities. Because I go back to thinking, who were we as tribal people? And it was to actually protect our children. They were sacred, right? Our elders are sacred. Our women were sacred. And so getting back to those kind of conversations and remembering who we are as Native people, and that's really to protect each other. So we're thriving and we're healing, and looking at all those other issues too, because they're all interconnected. We can't really get away with it. We have to focus on all of them at the same time to really make a huge difference. And that's been some of the messaging here, is to be able to really do that, honor that, but really hey, we need to really look at the reasons why we're more susceptible to drug use, right? And the alcoholism. We really struggle with alcoholism, and it's been overshadowed by the opioid epidemic. But man, alcoholism is so normalized, that we're losing people, and early on their health is really being affected. Early signs of Wernicke's too for our younger generations who are in their 40s and early 50s that are seeing the damage and effects of long-term alcohol use.
Thank you all so much, and thank you for our viewer, Dr. Pfeiffer, for that question. We know that so many of these issues are interconnected, and we can't talk about one without talking about the rest. So I'm going to hand it back to Levi now. Thank you all so much for joining us and for contributing to this very important discussion.
And thank you for tuning in today. The Reducing Drug Overdose in the country. We at Native News Online, we are proud to bring these types of live streams because it's so critical. And as some of the panelists talked about, it's not always easy and not always pleasant to talk about these. But when I say we're proud, we just feel like this is part of what we're supposed to do at Native News Online. And as a publisher, I want to say I appreciate my staff because we think about these things, we talk about these things often, and it's very, very critical that we address them, because these are issues that, and I like to say it this way, our ancestors did not survive genocide in boarding schools, so that we end up killing ourselves through substance abuse, whether it's opioids or alcohol, as Arlene talked about, that gets overshadowed sometimes, but it's still a very prevalent problem. So thank you very much to our sponsors. We will be back in October, on October 17th with a part 2 of this. And then to the viewers, if you have any suggestions or comments, please send them to us at editor@nativenewsonline.net, editor@nativenewsonline.net. And we are always wanting to engage with our audience. As many of you know, we do survey monkeys, etc. But I want to say thank you, Chimigwich, for tuning in. And this will be available after the Facebook. I think it's on for 30 days on Facebook, but after that, it will be on our YouTube channel. It stays there forever. So please, if you're running a clinic or whatever, you want to spread it to your employees, your fellow employees, your colleagues, your friends and families, please do that, because this is an important subject we need to address, and we will continue to work on these hard subjects at Native News Online. Chimigwich, until next time, have a pleasant summer.
Cherokee Nation. The Cherokee Nation is committed to protecting our inherent sovereignty, preserving and promoting Cherokee culture, language, and values, and improving the quality of life for the next 7 generations of Cherokee Nation citizens.